It's Monday, February 15th, and the time for your Barbados Today Morning news update. COVID-19 cases in Barbados continue to spike. 207 cases of the viral illness were recorded on Saturday, pushing the national count to 2,268, according to the latest COVID-19 dashboard from the Ministry of Health and Wellness. Of the new cases, 97 are male and 110 are female. There are now 605 active cases on the island, while 23 people were discharged from isolation. 1,639 people have recovered from the virus. There have been 24 deaths recorded so far. There's an appeal for nurses to get vaccinated against COVID-19. It's coming from President of the Barbados Nurses Association, Joanna Waterman, who is greatly concerned that some nurses have decided not to take the Oxford AstraZeneca vaccine.
With the vaccine rollout for frontline workers, that the uptake for nurses is the lowest at Queen Elizabeth Hospital and Psychiatric Hospital in particular. While nurses in specified departments such as accident and emergency, intensive care units, and of course the isolation and quarantine centres have taken up the vaccine in high numbers, nurses on the general wards of Queen Elizabeth Hospital and of course those at psychiatry are low. Now doctors, engineers, housekeeping, the data shows have recorded high uptakes, but the nurses who are directly at the bedside of patients need to arm themselves now with the only weapon in our arsenal to fight against this virus. This is now really worrying because the community spread and the increasing numbers of positive cases across all healthcare institutions, nurses need to make wise decisions concerning protecting themselves, their families, and their patients. Presently, we have a nurse severely ill due to COVID and several in quarantine from exposure.
She also called on nurses to trust local health officials and to seek information from valid sources.
Nurses need to avoid imbibing all the misinformation and myths on social media that is really holding them back. As president of this group, I have stepped forward and been vaccinated to protect myself, my family and community, and to demonstrate confidence in the AstraZeneca vaccine, in which the clinical trials and millions vaccinated to date show it is efficacious. That means it does work and is safe, with only minor to nil side effects. I feel great, with only minor discomfort at the site of the injection and some tiredness. So nurses, I appeal to you to assist our nation in the fight against this scourge, as I'll call it, by taking up the vaccine as part of your responsibility in maintaining the health of this nation.
At the same time, opposition leader Bishop Joseph Atherley says there needs to be a more focused educational program about the COVID-19 vaccine, given the hesitancy among the public concerning the jab.
I've always thought that once the vaccine was introduced here, you would have some challenges, some issues, some strong reservations, especially like the fact that it was introduced perhaps a bit even sooner than most people anticipated, and therefore it had to be preceded by a very strong education program. I think attempts have been made to do some of that, but I don't know that they've been strong enough, perhaps, or focused enough. And in these days of social media, you get all kinds of things being said, all kinds of things being exposed, all kinds of views contending. And therefore, in that kind of a context, Ministry of Health and government would have had an even greater responsibility for ensuring that truth in relation to the efficacy of these vaccines, the safety associated with it, the taking of it, was put forth in the public by some kind of a query education advertising program. I don't know that we have sufficiently addressed that. As in most things, I suppose, something appears for the first time, there's a level of apprehension or skepticism. Much of that is natural.
In other news, this Monday, a family is in mourning following the unnatural death of a loved one. According to police, 27-year-old Andrew Winston Ellis was found hanging at a Windy Ridge, Christchurch residence yesterday afternoon. The young man's body was discovered after lawmen received a report via telephone around 3:20 p.m. His sister, Paulette Nichols, who is struggling with the death of one of her favorite brothers, tells Barbados Today she was at work when she received the devastating news.
I work like 5 minutes away from where he lives. When I get there, I run straight to the house and I actually get to glimpse him. Right? It wasn't a good sight. Honestly, I don't know how he will cope with it, knowing that he is my young brother, one of my favorite, I should say. He was a good person. I mean, he don't give trouble. He don't never ever bad complaint. My brother, like, he driving, dancing, and them things like that. My brother just stay by himself most of the time. He have his friends and them that he's go to, but differently, he does be by himself. Peaceful person. It's real hard to know today he gone like that.
The Innotect group of companies plays its part in assisting with the National COVID Sick and Save program. Yesterday, Chairman of Innotect group of companies, Anthony De Silva, presented members of the Barbados Defence Force with some 200 cases of bottled water. De Silva said he hoped the donation would help members of the Sick and Save team with the campaign.
I hope that this goes some way to assist the efforts of the Seek and Save initiative, and notwithstanding whatever effort it takes in terms of human power, manpower, money, government support, if that program only saves one person, then that was an investment that we ought to have made, and can feel justified that our government has made a good investment in the health and safety of all of the residents of Barbados.
He also urged the corporate Barbados to assist with the effort in the fight against COVID-19.
This is a challenging time for Barbados. I mean, Barbadian companies have been stretched. There's no two ways about it since the beginning of last year. But surely we can do more as corporate Barbados, and we ought to assist where we can. Everyone can't do the same amount, everyone can't do the same efforts, but surely there's something that everyone can do to assist this national effort, because that's what it is. This is a fight that we're in together. So corporate Barbados, individuals, any stakeholders that feel that they can assist the government's efforts and the country's efforts as we confront this pandemic, then I encourage them to come forward and lend whatever assistance they can.
There's regional and international news after this short break.
Barbados Today, news you can trust.
To news from the region, the St. Lucia government says it is making significant headway in its bid to get COVID-19 vaccines into the country. More from DBS News.
Tourism Minister and Chairman of the Command Center, Dominic Fede, says government is making significant strides in bringing COVID-19 vaccines to St. Lucia. The minister says St. Lucia expects to receive 185,000 doses from India at a date to be announced. Through the CARICOM Alliance, St. Lucia is expecting an additional 35,000 doses of the vaccine. Altogether, the minister says this will be sufficient to vaccinate the entire population.
Consultation has started, Mr. Speaker, as we anticipate the arrival of the vaccines, some 74,000 doses, Mr. Speaker, by the end of February. Mr. Speaker, the government of India, through an alliance, we also anticipate at a time to be announced later, some 185,000 doses of vaccine. And Mr. Speaker, through the CARICOM Alliance, we're expecting another 35,000 doses of vaccine. Altogether, Mr. Speaker, we will be in a position to vaccinate the entire of St. Lucia.
Through the COVAX mechanism, the first 74,400 doses of the Oxford AstraZeneca vaccine should be rolled out by the middle of March, according to Minister Fede.
And finally, the COVID-19 vaccine rollout in England has entered a new phase after Prime Minister Boris Johnson said that the most vulnerable groups had all been offered a vaccine. More than 15 million people in the UK have had their first dose, and the rollout is now being officially expanded to the over 65s and younger people in at-risk groups.
British Prime Minister Boris Johnson hailed a significant milestone on Sunday as the UK hit its initial target to deliver 15 million first doses of COVID-19 vaccinations. After becoming the first country in the world to approve a vaccine, the British government began its ambitious programme in early December, with the aim to offer a shot to everyone in its top 4 priority groups, including all care home residents and frontline healthcare workers.
Today, we have reached a significant milestone in the United Kingdom's national vaccination programme. It has been a truly national, UK-wide effort. We've done it together. And I want to thank each and every person who has helped make it happen. You can be incredibly proud of the part you've played. And thanks also to everyone who has had a jab so far, giving protection not just to yourself, but also to your fellow citizens and to the NHS.
The vaccine programme is seen as one of the few successes in the UK government's handling of a pandemic that's left the country with one of the biggest death tolls in the world.
We've still got a long way to go, and there will undoubtedly be bumps in the road. But after all we've achieved, I know we can go forward with great confidence.
That's news. But for the very latest, visit us at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media in bus terminals, as well as screenplay at supermarkets and gas stations near you. And you can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.